The third reason why I don't like tissue expanders is that the tissue expansion itself can be very uncomfortable for patients and painful, and it's not convenient. I mean, who wants to go back to the office every week after they've just had a mastectomy? So typically, I start expanding my patients, if I'm going to do it, at 3 weeks, and that gives time for the incisions to heal completely. Because if you do it too early, the incisions can bust open. And I know some surgeons do it within 2 weeks, and I don't recommend that. So the other thing is, remember, these things are placed either under your skin or under your muscle if it's a subpectoral procedure. And what that means is that as this thing expands, it creates tension. And that tension is stretching your muscle and stretching your skin. No wonder it is very uncomfortable. And I've had patients explain to me how uncomfortable it was both during expansion and even after the expansion. And one tip is, if you are going to go for expansion, I tell all my patients, take a Tylenol as you're driving in, and that will help offset some of the discomfort. And if it's very uncomfortable during the expansion, tell whoever is expanding you, whether it's the nurse or the plastic surgeon, can you slow down? You know, let's just put 50 cc's in today. And I've had some patients go home after a pretty, vigorous expansion procedure and call us and say it's very uncomfortable. And in those situations, I tell them to come back and we take out some of the fluid.